Hi, I'm Sean O'Leary. I'm a pediatrician and pediatric infectious diseases specialist at the AAP National Conference and Exhibition. And I'm talking today about two studies we did, two surveys in students and parents of students that use school-based health centers in Denver, Colorado. School-based health centers have been shown to increase care to underserved adolescents. Also, there's been an increasing focus on the patient-centered medical home, which is defined by the AAP as care that is accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective. We wanted to look at how well school-based health centers performed as patient-centered medical homes, at least from the perspective of the students and parents of students that use school-based health centers. To do this, we did two surveys. We did one survey among students that were users of 10 school-based health centers. We did another survey in different families of parents of students who use school-based health centers. The primary findings of the studies were that both students and parents were very happy with the care that they had received within the school-based health centers. Most teens were either very or somewhat satisfied with the care they received. And regarding quality of care, 88% of students reported that providers were usually or always helpful, that they listened carefully, that they explained things well, that they showed respect and that they spent enough time, and that they explained that the care that they received was confidential. The vast majority of students reported that the school-based health center was available and they needed to be seen. Regarding continuity, the vast majority said that the school-based health center had providers that know them. And regarding being comprehensive, they almost all said that they offered lots of different services. Regarding care coordination, again, the vast majority reported that they were able to see specialists if need be. And regarding compassionate care, the vast majority reported that the school-based health center provided a kind, caring place to be seen. The parents reported very similar findings regarding all of those same constructs. We also wanted to look at how many of these adolescents considered the school-based health center as their primary source of medical care. Among the students, 34% reported that the school-based health center was their primary source of care. Among the parents, 33% reported that the school-based health center was their child's primary source of care. We also wanted to look at what were the characteristics of the parents who reported that the school-based health center was their child's primary source of care. Perhaps not surprisingly, we found that those parents were about 5 times more likely to report having no insurance. Somewhat surprisingly, though, one of the other characteristics was that they considered in their decision to enroll their child into the school-based health center, that they considered mental health services as a very important characteristic. The primary conclusions of our studies are that school-based health centers could function as patient-centered medical homes, at least from the perspective of the students and parents themselves. One of the implications of that is that policymakers should consider school-based health centers as potential sources of care. The other major point is that even if the students didn't consider the school-based health centers their primary source of care, all of the students used the school-based health centers a lot, which suggests that it's important that there's coordination of care with other primary care providers. In conclusion, in a low-income population, we found that school-based health centers did meet most criteria of a patient-centered medical home from the perspective of the adolescents and parents of adolescents that they served. The parents of the teen users also reported a high degree of trust in the providers at the school-based health centers, and most parents were very satisfied with the communication that they received. The reasons that the adolescents utilize the school-based health centers are similar to traditional medical homes. Parents also place significant value on school-based health centers' convenience, provision of desired services, and lack of financial barriers to care. Finally, policymakers and communities should consider school-based health centers as a way to provide a medical home for underserved adolescents while addressing any areas of potential weaknesses within the school-based health centers.